Low iron doesn't just affect your blood, it also affects your brain, energy, and nervous system. Low levels can contribute to anxiety, and you may be receiving treatment for anxiety even though no one has checked your iron levels. So could your excessive worrying, feeling on edge, sleepless nights, racing thoughts be due to an iron deficiency? Why do standard blood tests miss it completely, and how do you treat this? I'm Dr. Ayer, quadruple board-certified psychiatrist and anxiety expert. I've treated thousands of people struggling with anxiety, and one of the most common things I see, especially in adults who have already tried multiple treatments, is a completely overlooked root cause sitting right there in their blood work. 47-year-old Sandra, for example, had been anxious most of her adult life, but the past 2 years had become worse. She was waking at 3 a.m. in the morning, her heart racing, and her body tense. She was exhausted all day but could not rest. Her brain fog and poor concentration were affecting her at work, and she was struggling to keep up with both her professional and personal life. 2 antidepressants, neither one worked the way she hoped. Therapy helped her cope, but it did not touch the physical dread in her chest. She was eating reasonably well, she was exercising, she was doing everything right. When I reviewed her full labs, not just the standard panel, but the complete picture, her ferritin was at 11. For context, ferritin levels below 30 nanogram per ml are highly specific for iron deficiency, though the American Gastroenterological Association AGA recommends using a threshold of 45 nanogram per ml to maximize sensitivity. Ferritin is not the same as the blood count, and that difference matters enormously. I'll explain exactly why in a moment. But first, have you ever wondered why anxiety so often comes with physical symptoms? That restless electric tension in your body? There is a biological reason for that, and iron deficiency could be contributing. Most people think of iron as something that keeps their blood healthy, and yes, it does that. But iron is also very important for your mental health. Your brain uses iron to produce dopamine, not directly, but iron is essential for making the enzyme that starts the whole dopamine production process. Think of it like a spark plug in an engine. Without that spark, nothing fires the way it should. And dopamine is not just about pleasure or motivation. Dopamine is involved in how your brain regulates fear, how it decides what is a real threat and what is not. When dopamine signaling is disrupted, your brain's threat detection system gets affected. Your nervous system does not function the way it should. Here's another interesting fact. Iron plays a critical role in myelination. That is the protective coating around your nerve fibers. Think of the plastic coating around an electrical wire. When that coating is intact, signals travel clearly and fast. When it is compromised, signals misfire. The communication between the brain regions that are supposed to calm your stress response starts to break down. And when those calming signals break down, the alarm stays on. In a moment, I'll tell you about a major study that confirmed this is not just a theory. But first, here's something I see constantly in my practice that many psychiatrists do not check. When your doctor orders routine blood work, they look at something called a CBC, a complete blood count. They check your hemoglobin, they check your red blood cells, but here's what they're missing. Your body protects hemoglobin at all costs. It will maintain hemoglobin levels by depleting iron stores first. An iron deficiency can affect the brain and other tissues before anemia develops. The marker that actually reflects your body's iron supply is called ferritin. That is your stored iron. And most psychiatrists are not looking at it. Or if they are, they're using a cutoff designed to detect severe anemia, not to optimize nervous system function. Here's what I tell my patients. There's a big difference between not technically deficient and enough for your brain to work properly. Many anxious patients are living in that gap, and nobody has told them. An optimal ferritin level for brain and nervous system health is generally considered to be at least 30. With the AGA recommending 45, most labs use a lower limit of normal around 12 to 15 for ferritin, which is significantly lower than the recommended guidelines. That is an enormous gap. And this becomes even more common as we get older. For women moving through perimenopause, years of heavy periods can quietly drain iron stores long before any other symptoms appear. For men, chronic inflammation and metabolic changes can do the same thing without any obvious signs. You just feel anxious, exhausted, wired, and flat at the same time. Now, here's where the science gets really compelling. A 2024 study used a method called Mendelian randomization, one of the most rigorous tools researchers have for establishing actual cause and effect, not just correlation. They analyzed genetic data from over 200,000 people. The finding was clear. Higher levels of serum iron ferritin and transferrin saturation were each independently associated with a significantly lower risk of anxiety disorders. What this means is that higher iron levels in your blood were linked to a much lower chance of having an anxiety disorder. This was true for 3 different ways of measuring iron: the amount of iron in your blood, how much iron your body has stored, and how well your blood is carrying iron. Each one, on its own, pointed to the same thing: more iron, less anxiety. This was not a small study. This was not a survey where lifestyle differences could explain the results. The genetic design specifically controls for that, and the conclusion points in one direction. Iron status influences whether your nervous system tips into anxiety or stays regulated. This is why it is important to look at the full iron panel when someone presents with anxiety that has not responded to standard treatment, not just hemoglobin, the full picture. Now the question is, how many times has your mental health provider asked you to do labs for these 3 tests? So let's talk about what you can actually do with all of this information. 3 things. First, ask your doctor for a full iron panel. Specifically request serum iron, ferritin, and transferrin saturation, not just the CBC. Write those 3 words down. Second, if your ferritin comes back below 45, do not accept your iron is fine as an answer. Ask why it is low. It could be dietary, not enough iron-rich foods like meat or organ meat. It could be an absorption issue, gut inflammation, low stomach acid, or a gut condition that prevents proper absorption even when you're eating enough. Or it could be blood loss that has never been properly addressed. Third, and this matters, do not aggressively self-supplement. Iron is not benign at high levels. Too much iron carries its own risks. This needs to be a targeted correction based on your actual numbers, guided by someone who understands what optimal brain health looks like, not just what prevents clinical anemia. And one more thing, sleep and iron are deeply connected. Low iron disrupts the neurotransmitters that regulate deep sleep, and broken sleep keeps your cortisol dysregulated, which keeps your nervous system in threat mode, which makes the anxiety worse. It becomes a cycle. If sleep is part of your picture, I have a free sleep guide in the description. Download and use it, because fixing sleep is often the fastest lever for calming a dysregulated nervous system. Now back to Sandra. We identified her ferritin deficiency and addressed the root cause, a combination of dietary gaps, heavy periods, and a gut absorption issue that had gone unaddressed for years. It took a few months, but she described what happened as the background noise finally going quiet. Not silent, not perfect, but manageable for the first time in years. She told me, I didn't realize how much of what I thought was my anxiety was actually my body running on empty. That is exactly it. When your brain has the raw materials it needs, the tools you're already using, the medications, the therapy, the meditation, the lifestyle work, finally have something to work with. Now, if you want to understand the other hidden biological drivers that keep your anxiety high, watch this next video.